Hello, everybody, and a very warm welcome to our first webinar in our brand new series. My name's Oliver, and I'm the lead nurse at the UK Sepsis Trust. I'm just going to share my screen, which will provide some further information on some of the information we're going to talk about today. Just bear with me. Hopefully, you can see that. So, yeah, huge thanks again for signing up to join today's first webinar. Today's webinar, we're going to be looking at sepsis and navigating the early stages of recovery. We'll be hosting a new webinar every couple of months. The next session is covering fatigue post-sepsis, which is due to be hosted on the 25th of June. Details on how to sign up can be found on our website. This webinar will be recorded, so you can watch it back on demand. And there will hopefully be an opportunity at the end of the session for some Q&As. So feel free to pop any Q&As in the Q&A function. But I'd also encourage you to reach out directly to us if you have any specific questions or if you'd like to discuss anything that's covered today in a little more detail. And we're going to be covering a few important topics today. Sepsis is a complex topic, so it's impossible to cover everything in a limited time. But hopefully by the end of today's session, you'll have a greater understanding of what sepsis is and some of the practical steps to consider that might help to enhance yours or someone else's ongoing recovery. I think a good place to start is just introducing myself so you know who's talking to you. I'm a registered nurse, and the majority of my clinical practice was in the Midlands. I worked in the NHS, predominantly in intensive care for about 12 years before joining the charity in 2018. I've looked after many patients in my clinical practice with sepsis, and as part of my role for the charity, I help to support those affected. And hopefully you know who we are as an organisation. We're a national charity. We were founded in 2012 by NHS consultant Dr. Ron Daniels, who is our Chief Medical Officer and still works very hard as an intensivist in practice. And our mission is to end preventable deaths from sepsis and improve outcomes for survivors and those affected. And we do that in a few different ways. We instigate political change, we educate healthcare professionals, we help to raise public awareness, and we provide support to those people who are affected. So what is sepsis? That's a good place to start. And I think a good place to start is with the definition. So the official lay definition tells us that sepsis is a life-threatening condition that arises when the body's response to an infection injures its own tissues and organs. A common misconception is sometimes that sepsis is an infection in itself, or that you might be able to catch sepsis. But importantly, the focus here is on the body's response to an infection and not the infection itself. It's always triggered by an infection, and it's when the immune system, which normally works to protect us, goes into overdrive. And if we don't stop it, then it can start to cause problems with the blood supply, to the tissues and organs, and it can make us very poorly. As highlighted in the definition, sepsis always starts with an infection, pretty much any infection, and it's when microorganisms, whether it be bacteria, fungi, or viruses, are the primary cause of infection. And we get an infection when those microorganisms get to where they shouldn't, or when they multiply to levels where they can cause us harm. And we know, of course, not all infections will need antibiotics, and some do get better on their own. Sepsis primarily involves the immune system, and our immune system is a complex network of cells, proteins, chemicals, and organs that work together to protect us. And it would include things like the spleen, the white blood cells, the lymphatic system, and our skin. And when we're unwell with an infection, we largely feel unwell and experience symptoms due to the immune system response and not necessarily the infection itself. And that immune system response is normally localized, controlled, and well regulated. Everything is doing what it should be doing in a nice, controlled order. In sepsis, that immune response becomes overwhelming. And therefore, instead of being localized, it can affect the whole body. Instead of being controlled, it becomes uncontrolled. And then instead of being regulated, it becomes dysregulated. Lots of immune chemicals are released into the bloodstream to help fight infection, which can then trigger a series of inflammatory reactions. And it causes systemic inflammation. That can cause a drop in blood pressure, which can then change how blood and therefore oxygen and important nutrients are distributed around the body. So what can cause sepsis? I think it's important we touch on this today. Of course, not every infection will cause sepsis, but almost any infection can, and that's why awareness is so important. The most common infections leading to sepsis will include things like chest infections, so like pneumonias or bronchitis, urinary infections, so infections in the bladder, the urethra, which is one of the tubes in the urinary system, and our kidneys, abdominal infections like appendicitis, diverticulitis, or peritonitis, skin and soft tissue infections like wounds, cellulitis, abscesses, etc. The rest are made up of things like infections maybe around the heart or invasive device related infections and meningitis as well. And a really important question to consider is, well, why do some people develop sepsis as a result of an infection and some people do not? And other than the risk factors, so we know that some groups, some people are deemed at higher risk of developing infection and therefore sepsis. Other than those risk factors, we don't fully understand yet. And there are a number of factors that are likely to play a part. They will include things like the type of bug that's causing the infection. So what type of infection is it? The number of bugs present, so how severe is that infection? And then individual or host genetic factors that might mean we're more predisposed. So if 100 people all develop the same urine infection, their response would be slightly different. A majority might have increasing symptoms until oral antibiotics were commenced. A handful of people may shrug it off without needing antibiotics. But then a handful on the other end of the spectrum might develop sepsis. And the truth is it's often impossible to predict who will deteriorate in that context of infection until that deterioration begins. So we've briefly covered on what sepsis is and why some people might get sepsis and what the causes of sepsis. But really important, we look at sepsis recovery. And what can recovery look like? Well, for most people, their journey doesn't end at hospital discharge. In fact, people will commonly tell us that's when it really begins. And the evidence suggests that it's common to experience new limitations for a period of time following sepsis, suggesting that as many as 75% of people develop at least one new diagnosis after hospital discharge. And it's really important to remember in terms of recovery, it's not a one size fits all. We can't apply a broad brush stroke to everyone who's had sepsis, just similarly to other conditions like heart attack and stroke. It is variable and there are always exceptions. And evidence will tell us things like age, pre-existing health, length of hospital stay, and genetics may all play a part in terms of what people might experience, but then also how long it might take them to recover. And that variability relates to those challenges and also time, but also, as mentioned, the time it might take to reach that point of full recovery. And it's also nuanced. It is varied, and there often isn't a clear line in the sand where people can separate ongoing recovery to then being fully recovered. It can be more organic, with people noticing a general trend of improvement over time. Some people do make a full recovery and can return to their pre-sepsis status or life, if you like. But for some, they may have to navigate ongoing challenges over time. And we're quite careful to give a time frame due to those variables, but it is common for people to say that it might take up to 6 months before they might notice some real noticeable improvements in some of their symptoms. So why do people experience challenges? Well, it's largely what is happening when we have sepsis. Consider that the definition of what's going on. But it's also compounded by other factors. It's important to remember the very nature of being in that acute hospital setting is bad for you. And I think we sometimes forget that. If we consider what happens in hospital in terms of physical deconditioning due to the reduced mobility, various medication and new medication. Most people have a reduced nutritional intake in hospital, sleep deprivation, and psychological trauma, whether that's to what happening to us or witnessing happening to other people. We kind of put all that in a mixing pot, as well as having sepsis, and it's understandable why people can experience challenges for a period of time. And the common challenges can be broken into 3 separate groups. So physical, cognitive, and psychological. And this is by no means an exhaustive list, but some of the more common challenges that people can experience. Other symptoms, other options, other possibilities do exist beyond this. And some people's challenges may be focused on one category, whilst others might be able to tick all of them. I think it's important to highlight that many here are invisible to others, particularly the cognitive and psychological, which in itself come with their own challenges. And we're often only good at understanding and supporting what we can see. And those invisible limitations can be difficult to describe to each other, but to others, but they can be equally as challenging. And as the more physical symptoms. And important to highlight, it's not just those people who go through these doors to critical care who might experience problems. Lots of people who are very sick might not need admitting to critical care. And these people, even more so, might slip through the net, if you like, in terms of follow-up support. Evidence will tell us they can still experience lots of the same ongoing challenges as people who may go through critical care. So it's not just dependent on that admission to critical care, which I think is important to highlight. As mentioned, for most people, the journey really begins once they get home. And this is often compounded by the fact that they may have left hospital with no or very little information about what actually happened and then what to expect. But generally speaking, how people feel in those first few weeks is largely to be expected, given how poorly they have been. And remember, all those things that are happening when we're acutely unwell with sepsis and in hospital, it's anticipated there will be a period of recovery. And there are lots of metaphors that people might use to describe what it's like having sepsis. And a hurricane is one of those. And like a hurricane, with sepsis, it can take time for the winds to die down and for the dust to settle and for us to really notice how we may be feeling. And I think it's important to remember this, particularly in those early stages. It's really important to manage those expectations and acknowledge that for a period of time, you may not be able to sustain both physical and or cognitive activities to a level that you were able to before, or even at all. And that's really hard. And that you'll likely feel different emotionally, which will commonly include feeling more vulnerable. And we'll touch on that a little bit in a moment. So I'm just going to briefly cover three of the most common challenges that people can experience during those early stages of recovery. And I'm going to start with fatigue. And this is by far the most common. And as mentioned, it largely expected to some degree, but it is a spectrum. And it does need to be managed carefully with a gentle approach and increasing in activity as tolerated and guided by your symptoms. Adopting that kind of push on through regardless approach can sometimes be detrimental. So a starting point is by stopping, and it sounds strange that, but just taking that moment just to pause and try and understand the baseline you're starting from. What are you able to do? What do you find more challenging at the moment? All this can give a real insight, and using a diary with this can really help in terms of that appraisal and reflection. Trying not to compare to others is important, but also not to compare where you were before. Use that first day back at home from hospital as your measuring point. And if you were looking at then compared to now, could you see that there's some progress there? Try not to compare, well, I was able to do these things before. That's probably only going to lead then to feelings of frustration and disappointment. Acknowledge those limitations. I'm going to say that a lot today. It's not easy. And acknowledgement doesn't mean accepting and giving up, but just that gentle acknowledgement of where you are and how you can best support yourself through this process. When managing fatigue, it's finding that delicate balance between activity and rest. Too much of either of those, if we just focused on activity and try and push on through, it's probably going to be detrimental. But then if we just did nothing and just rested the whole time, then that's probably going to then lead to further deconditioning. So it's trying to find that gentle balance between the two. Again, it isn't easy and will be a little bit trial and error. And when we talk about fatigue, we often talk about P's. And this time the three P's. Firstly, from a prioritization point of view, think about what needs to be done. This is different from what we think should be done. We will all have activities that we deem as more important. This might be related to home or work, admin, or maybe we have other people that are reliant upon us, children or parents. These activities might be deemed as more important and a priority. We can reflect on our energy budget, if you like, and allocate some more of that budget to those activities, and to see then what we've got left to do what we might think is less important activities. Second P is pacing. Pacing is all about balance and managing activities. And factoring in rest, importantly, even if you feel like you can do more, just spending just enough time doing an activity so you get the most out of it without pushing yourself so you use up all of your energy budget. Pacing is, again, really challenging concept, and it's not easy, and it can sometimes take time to learn your threshold and your baseline. And lastly, the third P is planning. Try and plan how and when you're going to do your activities. Again, using a diary or a planner can help with this, and how difficult you anticipate they might be. And once you start to learn a little bit more and through that diary, that would normally become a little bit easier once you start to understand what you're working with and your baseline and any patterns that may emerge. Second thing to cover today is brain fog. So a real common challenge that lots of people experience. And this is related to those cognitive symptoms I mentioned earlier, like problems with memory, focus, and attention. As mentioned, this is invisible to other people. And that can add that other challenging layer. So similarly to fatigue, it's really important to acknowledge where you are currently at and try and manage those expectations. Trying to think more or concentrate harder, like I will get this done, can sometimes make this worse, and it can feed into that bit of a loop of frustration and disappointment, which will only further cloud your brain fog. It can also really help to let people know what you're experiencing, help to manage their expectations as well. Planning, like with fatigue, is really important. Maybe consider a gentle routine for your day, and as you learn more about your limitations, this would normally become easier. There are lots of really good free brain training apps available, and these can provide a really useful way to measure your progress over time. Manage those expectations. You'll likely have to start at a level lower than you previously were at, and that's hard, but that's okay. Controlling your environment is really important. Try and minimize those distractions. Maybe consider a quieter setting, focusing on one task at a time where possible. Break those tasks into smaller, more manageable chunks. And it's also okay to say no to some things, which again can be a challenge in itself. And consider utilizing some memory aids as well to help support you along the way. There might be calendars, whiteboards, sticky notes, alarms, reminders, and asking for and accepting help from other people. Again, this is sometimes a concept some of us find challenging. So the third thing to cover today is a worry and anxiety, and it's, I think, understandable that most people will have a heightened level of worry for a period of time and feel hypervigilant and on high alert. And I think that's an appropriate response within reason. You've been through a very frightening and unsettling time, and your brain is considering what it can do to try and make sure that doesn't happen again. So some strategies to consider. First of all, naming it to taming it. So acknowledging your thoughts is really important. Maybe saying it out loud. I notice that I'm having an anxious thought and it's making me feel afraid. This can really help to create a healthy distance between you and that reaction. So you're kind of creating that barrier between your thoughts and how you're feeling. Try and calm that physical response as best you can. So those physical symptoms like a racing heart, breathing quickly, a pounding head, that can sometimes feed the fear and can make us feel worse. So strategies like some slow, deep breathing, some grounding techniques, or light, gentle movement, going for a very gentle walk, can help to regulate the nervous system. Try and limit those reassurance-seeking loops. So something we all do nowadays, it's very tempting to turn to Google, for example, and Google our symptoms. And whilst we think this might help in the short term, it can sometimes feed the fear. So really be mindful of what you're consuming and just pause for a moment before engaging in an activity like that and ask yourself, is what I'm about to do going to make me feel better? And maybe consider just replacing it with a more helpful and restorative activity. Gently challenge those what ifs. So anxiety will often sound like, well, what if this happens? And what if that happens? What if I get sepsis again? Remind yourself that you know the signs. For most people, once they've had sepsis, they're more aware of some of those sometimes more subtle signs in their body. So remind yourself that you know the signs and you're safe at the moment. I'm at home and I'm safe and I know the signs. And you can have a plan if the symptoms change. And having that just in case plan that can really help remind yourself that, well, I have a plan here depending on how I'm feeling. And it can stop you scanning for danger quite so much. And that might include who you'd call, where you'd go, and what symptoms relate to what action. So writing down those possible scenarios. Really important is sharing how you're feeling. This might be someone close to you, friend, work colleague, family, or one of us on the helpline. Talking it through just help reduce that intensity and gain some balance. Or you could start a worry diary and offload some of those unhelpful thoughts from your mind, and break them down and consider if they're practical or hypothetical worries. So some more general top tips for recovery. So number one, manage those expectations. I've said that quite a bit today, but it's really, really important. And we're often our own worst critic. Try limit using phrases like, I should be better by now, or I should be able to do that by now. Remember, you're doing your best, and how you're feeling isn't your fault. Talk about how you're feeling. Expressing our emotions is healthy, and you're human. Some people might think that because you're home, you're better, and you look well. So managing other people's expectations is important too, and it can sometimes help just lighten that load a little bit and feel like we don't have to perform, if you like. And that can also help with asking for help and from other people as well. Really carefully listen to how you're talking to yourself, and I think this feeds into managing those expectations as well. Maybe changing, I can't do that anymore, with, at the moment, I'm choosing not to do that. It's a subtle difference, but it really can make a difference. Celebrate your achievements, no matter how small you might perceive them to be, or other people might perceive them to be. Small steps forward are still steps forward. Try and find those measurable actions, and document those in a diary or a planner, so that in a month's time you can reflect back and say, yeah, a month ago, walking up the stairs, I was needing to stop 2 or 3 times, whereas now I'm stopping once, or I'm not stopping at all. That's really measurable, and that sense of achievement as well. Remember to factor in some distraction, some restorative distraction and me time. Recovery can sometimes feel all-consuming, so it's important to try and focus on other things, even if those other things might be a little bit different at the moment. So maybe an opportunity to try something new or a new skill. And remember that everything we do is an activity that requires energy. Sleep requires energy. Cognitive and emotional activities will also draw on your energy reserves. If you consider how energy resourceful worrying is, sitting and worrying about something can really wash us out. So it's not just those physical tasks that we might consider that need energy. Everything we do requires energy, and we just have to maybe carefully manage where we're spending that energy. So some of you may have already connected with us. It's really easy to get in touch with us. We have a helpline that's run by myself and my colleagues. We respond to email requests. We have peer support Facebook groups, and then we also host weekly online Zoom groups as well. And just remember that we're here to help and support you during this journey, whether that's a new inquiry, a new question you might have, or even just speaking with us or emailing us. Let us know how things are going, that reassurance that we might be able to provide. And also, if you're doing well, tell us that you're doing well. We love to hear those kind of things as well. We're a really small team, so there's 3 of us in the team, myself, Emma, and Katie, and we all hugely enthusiastic, and we all have a very similar background as well. And we help in a few different ways. So sadly, we hear from lots of people that they leave hospitals, as mentioned, with little, no information or support. And then maybe then when they do try and access help, they don't feel listened or validated, and they can leave maybe consultations feeling worse or worryingly that they're to blame. So we can provide that non-time constrained listening ear, which can really go a long way. We can provide that practical information, talk to you for a period of time over time, help you to manage those expectations, and importantly, give some hope and encouragement for the future as well. So thank you all for joining today and for listening. I'm just going to stop sharing now for a moment, and I'll have a little look in the Q&A function. So if anyone has any questions particularly that I can have a little look through, please don't hesitate to pop anything in the Q&A function. I'll leave it open for a couple of minutes. Yep, so someone's asked if possible to view recording. Yeah, so this is being recorded, and you will get sent a link to the recording. It will also be hosted on our website as well, so you can watch it back on demand, and you can pause or yeah, do anything you'd like to do with it. So someone's asked, is mindfulness helpful in recovery? Yeah, absolutely. Anything I think that can help calm that kind of nervous system and make us feel present. It'll probably, well, evidence would definitely suggest it have physical benefits, but also psychological and emotional benefits. So yeah, absolutely, Gail. No worries. Well, thank you, everybody. I don't think there's any more questions coming through, but yeah, please don't hesitate to let us know if you have any questions, if you'd like to connect with me or one of my colleagues offline, just to discuss anything that was raised today or talked about today, or anything else. More than happy to help and to speak with you. And as I say, hopefully we'll be hosting one of these sessions every couple of months, covering different topics, inviting some guest speakers to share some topics as well. So I'm really pleased you were able to join us today, and thank you. Enjoy the rest of your day.